The team generally consists of a physiotherapist, occupational therapist, and therapist assistants. The therapy team will visit you and begin mobilizing. It is quite common for you to have pain, low blood pressure, dizziness, lightheadedness, and nausea after your surgery. Please let the team member know if you experience any of these symptoms or if you feel something unusual. You may need to rest until you feel better before continuing to mobilize. In conjunction to mobilization, you will be completing exercises with the therapist assistants to improve range of motion and strength. During your stay, we will make it a goal to continue progressing the distance and the quality of your walk. You will also continue to progress with the range of motion and strengthening exercises. As you continue to meet your rehab goals, you will be expected to return home once you are medically stable. We are going to review a series of exercises that are important to complete after your surgery to regain your range of motion and strength. We recommend that you practice these exercises before your surgery to become familiar with them, as well as increase your strength and range of motion before the surgery. When completing these exercises, use pain as your guide. These exercises should never cause pain, and if they do, please stop and consult with your therapy team before proceeding. It is also important to not hold your breath while exercising. You are recommended to complete 20 repetitions of each exercise 2 to 3 times per day. However, if you cannot complete 20 repetitions, complete as many as you can tolerate. Ankle pumping. This is an important exercise for ankle mobility as well as improving your circulation. Lie on your back, bending at the ankle, point your foot towards you and then away from you. Hold each repetition for 5 seconds. You can do this exercise on both legs. Short arc quads. Lie on your back and place a large roll under your operated leg. You can make a roll by rolling up several towels or wrapping a coffee tin with a towel. Lift the lower leg off the bed and hold it in the straightened position for 5 seconds, and then lower. It is important to keep your foot pointed to the ceiling when completing this exercise. Remember to remove the towel roll after the exercise, as it is important to keep the knee straight while you are in bed. Quadriceps setting. Lying flat on your back, tighten your thigh muscles and press your operated leg flat into the bed. Hold this for 5 seconds and then release. You can place your hand under your thigh or feel for the muscle tightening. Gluteal setting. Lying flat on your back, squeeze your buttock muscles together. You can place your hands on the sides of your buttocks to feel the contraction. Hold this for 5 seconds and then release. Heel slides. Lie on your back with your knees straight. Bend your operated leg by sliding your heel towards your buttocks. You can place a garbage bag under your foot to help the heel slide. Hold this position for 5 seconds and then release. Active assisted hip and knee flexion. You can position yourself either in lying or in a semi-reclined position. Place a belt or strap under the foot of your operated leg. Then start bending your knee as much as possible on your own. Then gently pull on the belt or the strap to bend the knee a little more. Hold this position for 5 seconds and then straighten the leg back to starting position. Long arc quads, knee extension. Sit in a supportive chair with your thigh fully supported. Straighten your operated leg by tightening the thigh muscle until your leg is as straight as possible. Hold this position for 5 seconds and then release. Remember not to lift your thigh off the chair surface. Seated knee flexion. Sit in a supportive chair with your thigh fully supported. Gently slide your operated leg backwards. To get a greater stretch, keep your leg bent and foot flat on the ground. Then move yourself forward in the chair. You can use the other leg to assist you. Hold this position for 5 seconds and then return to starting position.